Thank you, Linda. It's an honor to be here with sisters and brothers in the faith. It's the official position of the United Methodist Church that health care is a human right.
Amen.
And that it is a governmental responsibility to provide citizens with health care.
Amen.
In 35,000 churches across the United States, there are far too many people in our pews who have fallen through the cracks in our broken health care system, who are not able to afford insurance and are ineligible for Medicaid. In one state, for example, you can make as little as $5,000 a year and be ineligible for Medicaid. Each and every day, our clergy counsel people who lack access and are in the midst of healthcare crises. The stories we hear reflect people who die from lack of healthcare coverage, who are bankrupted by huge healthcare bills and are unable to provide or afford coverage under private health insurance plans. Let me share one story with you. Barbara, an attorney, her husband and children were covered by health care provided through her law firm. She developed cancer. She needed and received treatment, and fortunately her cancer went into remission. However, a few years later her cancer returned and the family was dropped from their health insurance. This woman faced a decision that no one should have to face. Barbara's choice to divorce her husband so that he and their children would continue to receive health care. Now, because of the Affordable Care Act, Barbara will no longer have to make this decision because she will be covered.
Thank you, Lord.
Health care companies can no longer place lifetime coverage caps, and Barbara cannot be denied coverage due to a pre-existing condition. Tragic stories of loss of health care access should not happen in this great country. And it vividly illustrates why the Affordable Care Act is so desperately needed by ordinary Americans. The growing cost of health care means many of our own clergy and their families have inadequate health care, and many of our local churches have had to resort to part-time leadership. Many of our lay employees, choir directors, janitors, church secretaries, and youth workers go without health benefits because of the high cost to their congregations. The Affordable Care Act is a giant step in the right direction to addressing access to care. As the economic and civil rights issue that it is, and it further reduces barriers to comprehensive and affordable coverage to many racial, ethnic, and other vulnerable communities. Quite simply, we believe the Supreme Court and the decision it makes is a reflection of the moral and ethical character of our people.
All right.
Providing comprehensive health insurance reform ensures every single person in the United States has access to needed care without regard to their ability to pay. To do otherwise is to elevate private insurance interests above the needs of human beings. Today and every day, people of faith offer a prayerful witness for our country to show moral and political leadership and stand up for the people who would most be helped. That's why we're here today. Amen.